Every African parent shy from unwanted pregnancy, not to talk about discussing abortion. Surprisingly, some parents even encourage abortion, even after knowing that abortion is illegal in Nigeria. Have you ever been pregnant and this dude is telling you that I don't want that baby, I don't want you to keep that baby, I want you to abort it? Come here. To my teen ladies, I want you to be well informed so that when a man is telling you that I want you to terminate that pregnancy, I want you to abort that pregnancy, so that you will know the risks that is involved. So let me define abortion. Abortion is the early termination of pregnancy, either by removal or expulsion of an embryo or a fetus. World Health Organization define abortion as expulsion or extraction from its mother, a fetus or an embryo, weighing from 500 grams or even less. Before I proceed, if you are not a subscriber to this channel, don't forget to subscribe. And if you find this video very educative to you, don't forget to give us a thumbs up. And if you feel we're lacking in any way, don't forget to add your comment or include your comment. As still remain Royal Counseling Outreach, this is your online counselor. My name still remains Rachel. Talking about abortion in terms of the law, we have legal abortion and illegal abortion. Legal abortion is an abortion that is done by a trained personnel. I want you to take note of trained personnel and a safe clinical environment. A safe clinical environment with the well-needed equipment to carry out the abortion. With the well-needed equipment to carry out abortion or manage complications. Meaning, this legal abortion is done by trained personnel. Well-needed equipment is available with a safe clinical environment. In countries where abortion is legal, it's allowed, you hardly hear of complications, serious complications. You hardly hear of death rate of abortion. You hardly hear that a teenage girl or a woman died of abortion, because it is conducted in a safe environment with well-needed equipment with trained personnel. Now let's talk about the illegal abortion or illegal abortion. The opposite of the legal abortion. Illegal abortion is an abortion that is conducted by an untrained personnel, done in an unsafe clinical environment with an unequipped materials or needed equipment to manage the abortion or manage complication if crisis occurs. World Health Organization define unsafe abortion as the termination of unwanted pregnancy either by a person lacking necessary skills or in an environment lacking minimal standard of medical facilities. Now let's ask, is abortion legal in Nigeria? We're going to be using Nigeria as a case study. In countries or in continents where abortion is legal, is allowed, you hardly hear of critical complications or serious complications from abortion. You hardly hear that a teenage girl died of abortion, because it is legal, because it is done in a safe environment, clinical environment with equipment, well-equipped environment. But in countries where it is not legalized, it is usually done by quacks. So that means it is not it is not done in a safe environment. It is not done with well-equipped materials. So when you find out that an individual says, I'm going to carry out an abortion for you, and the person is a medical practitioner, it's either the person is ready to lose his or her license or the person is a quack. So take note of it. Anybody that agrees to do an abortion for you in Nigeria, we're going to use Nigeria as a case study. That means the person is either a quack or the person wants to lose his or her license. Now let's talk about the two forms of abortion. We have number one, spontaneous abortion, which is usually known as miscarriage. Number two, induced abortion. For the purpose of this study, we're going to just concentrate only on induced abortion. Let's talk about the methods of induced abortion. Number one is medication. That's the use of drugs and capsule and the rest. Number two is surgical procedures. I'm not going to list any drug for you. So for the purpose of those that their ears are widely open to hear the names of drugs for induced abortion, sorry. Under surgical procedure, I'm going to be listing 4 different categories. Number one is manual vacuum aspiration. I'm not going to explain so that you don't try to carry out surgical procedure on yourself. Number 2 is dilatation and evacuation. Number 3 is hysterectomy, and number 3 is dilatation and curettage, which is commonly called D&C. Let's talk about the complications of an illegal abortion or an unsafe abortion. Number 1 is immediate abortion. Immediate abortion is the one that you start reaping the reward of your labor. Instantly, you know that, okay, this person that carried out this abortion is a quack. Number 2 is late complication. Number 2 is late complication. That is the one that you don't get the reward of your labor immediately. Maybe like 10-15 years from now, when you start looking for children, then you realize that, oh, the person that carried out that abortion that I thought he was an expert, that I was feeling the guy good, was actually a quack. So now let's talk about the immediate complication. Number 1 is hemorrhage. When you are bleeding non-stop, the bleeding is continuous, and you hear the quack telling you just dey go house, just be going, don't worry, that bleeding is going to stop. It's just a matter of time, it will stop. They are pushing you out of their space so that you don't die there. Number 2, we have trauma to the pelvic structures, like perforation of the uterus, which can affect the bladder or the intestine, and if care is not well taken, the person can pass out. Number 3, we have acute pelvic infection. Because the materials or the equipment used are not sterilized, or it is not done in a safe clinical environment, you can be infected. You can either have HIV, hepatitis, urinary tract infection. I talked about urinary tract infection in one of my videos. If you are yet to watch it, go watch it. Number 4, we have renal impairment. When you suffer from lots of bleeding, of course the kidney is one of the first organ to suffer severe blood loss. Once the kidney is affected, it can lead to acute renal failure. So if care is not properly taken, or it's not well managed, that bleeding is not well managed, it can lead to kidney failure or kidney disease. So imagine just trying to have an abortion, and at the end of the day, the person is coming out with kidney failure. Just think about it. Does it worth it? Let's talk about the later complications. When medical practitioners ask some ladies, how many gravidals have you had? You'll be hearing 10, 20, 15. They are trying to ask, how many abortions have you carried out? And when you hear ladies mentioning some ridiculous amounts, you'll be surprised that on top abortion, it has been observed that some ladies just carry out abortions just for them to enlarge their boobs instead of going for BBL, instead of going for enlargement procedure. So they decide to be carrying out abortions as a means to enlarge their boobs, which is not well encouraging, because at the end of the day, you might not have the immediate complications. You might have it later in life. Let's talk about the later complications now. Later in life, you can hear that somebody is suffering from, number 1, chronic pelvic inflammatory disease. At the end of the day, you'll be hearing that the person is suffering from inflammatory disease, a chronic one, not just quick one, chronic one. Number 2, infertility. You start seeing them going from one prayer house to the other. I'm not saying some people that are going to prayer house did abortion. I'm only saying, check yourself. If you know you have once carried out an abortion, please just carry yourself and go for checkup. Don't just sit down there and be going from one prayer house to another. You might not receive the reward of your labor. Immediately you had that abortion, it might be later, which is now. Number 3, you hear ectopic pregnancy. So sometimes you say, what have I done to God that all the babies are growing outside the womb? They are not fertilizing in the womb. I talked about ectopic pregnancy. We hear, what has God done to me that I'm having ectopic pregnancy? All my children are fertilizing outside the womb. You are receiving the reward of your previous sins. That is why you are having ectopic pregnancy. Number 4, we have cervical incompetence. Once you get pregnant, that cervical tissues is a very fragile tissue. It closes. When you are about to give birth, you hear that the person has contraction. It opens back for you to give birth. But you hear some women saying, I can't carry my baby to term because once I get to 5, 6, 7 months, I have miscarriage. Because you have been opening that fragile tissues to carry out abortion. You have been opening it back to back, you have been opening it. The tissues is finding it difficult to close back. So the tissues is a little bit open. So once the pregnancy grows to an extent, it can't hold it again. It just releases it and it drops. And it leads to miscarriage. And you say, I can't carry my baby to terms. It is as a reward of that quack that did the previous abortions that led to this issue. Number 5, we have psychological problem. You hear I'm depressed, I'm having mental stress, I'm faced with heart palpitation, my heart is doing big 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 big, I am faced with anxiety. Because you are having either ectopic pregnancy or you are battling with fertility issues, it's as a result of the previous abortion. That is why you are having heart palpitation. That's why your heart is pounding like mortar. 5, we have Rhesus isomerization. This is as a result of you getting pregnant for a person who is not in the same Rhesus factor with you. For instance, you are O negative and you get pregnant for somebody who is O positive or B positive. Once you get pregnant, it is normalized that after childbirth, you are supposed to take a particular injection so that other pregnancies that you get after, you won't be facing miscarriage. But a situation whereby you got pregnant and you decide to have an abortion, you didn't take the injection after the abortion, you just had the abortion, you say, oh, thank God, they don't do am, you don't clear. Then later in life, when you get married, it's common among those people who feels I'm holy. I'm not a church person or I'm not a cleric person. You see them, at the end of the day, when they get pregnant, they might not even recall that I once had an abortion. I'm now a new creature. I was supposed to take a particular injection. And they won't be able to discuss with their spouse if they later remember that, okay, I had an abortion for a person with different reasons from mine. They won't be able to discuss with their spouse that, okay, I want to go and take so injection, or I did not take so injection. That's why we're having miscarriage. They won't be able to tell their spouse. They will just end up going from one prayer house to the other and be crying that, I don't know, I'm getting pregnant. God, what have I done to you? I'm getting pregnant and I'm having miscarriage. Because you had sex or you were pregnant for somebody in a different resource with yours, and you did not take the injection you ought to take. That is why that miscarriage is occurring constantly. In summary, if somebody is asking you to carry out abortion, like if you are pregnant now and your boyfriend is asking you to carry out an abortion, especially to my teen girls, that's my teenage girls and my adolescent girls, and somebody is asking you to carry out an abortion, please, I want you to think of the immediate complications and the later complications. Because in Nigeria, especially if you're in Nigeria, it is usually carried out by quacks or a medical doctor who is ready to lose his or her license. And I'm definitely sure no right-thinking medical doctor will want to lose his or her license for you, because you are not princess, you are not omnipotent. So I don't think anybody will want to lose their license because of you. Then, if you have knowingly or unknowingly carried out an abortion, please seek post-abortal care. See your medical practitioner, see your counselor. If you are not yet a subscriber, don't forget to subscribe and don't forget to give us a nice comment and give us a like. If you need counseling service for any problem, either personal, social problem, marital problem, relationship problem, vocational problems, don't forget to book Royal Care Counseling Outreach. And if you need anybody to help you with your outreach program, you want to speak to some girl child, you want to speak to some boy child, you want to speak to adolescents, you want to speak to teenage girls, boys, and you need somebody to help you with that outreach program, don't forget to book Royal Care Counseling Outreach. I still remain Rachel. Bye-bye.